classmates. My name is Louis Evans. I did my topic on antisocial personality disorder. I'm going to touch up on a couple of things that she spoke about, a couple of serial killers that have this type of symptom. Well, according to the Mayo Clinic, antisocial personality disorder is a type of chronic mental illness in which a person's ways of thinking, perceiving situations, and relating to others are abnormal and destructive. The particular disorder has proven to be among the most challenging disorders for psychologists to diagnose and treat. There are three factors that make this disorder difficult to detect. The highly ingrained behaviors of the disorder, the difficulty in differentiating between normalcy and illness, the patient's lack of understanding and expecting their symptoms as abnormal. Historical context. Early on, as ASDP disorder was referred by many psychologists as psychopathic disorder. However, it was changed to antisocial personality disorder. History has also provided us with some of the most notorious serial killers who have been diagnosed with antisocial personality disorder. Ted Bundy, Ed Gein, and Jeffrey Dahmer have been infamously written off as history's most brutal, violent criminals. Theodore Ted Bundy, he was born in Burlington, Vermont. He was a handsome, charming, cultured young man, and he was also notorious, though. He began murdering at age 14. He was executed in 1989 after confessing to 40 murders. He was diagnosed with antisocial personality disorder. Along with John Wayne Gacy, the killer clown, he was born in March 1942 in Chicago, Illinois. The owner of a contracting business and performing joker at children's parties. So that's the way he would con his children into murdering them. He would actually, perform jokes, tricks, and gaining their trust, and then raping them, murdering them.
Why would anyone be afraid of clowns?
Yeah, exactly. Well, he confessed to 24 murders and drew a map of 28 graves under his house and garage. He also said that he threw 5 into the Des Plaines River. He claims that he had different personalities, so he had different personas. Like he had the clown, and then he had the serious businessman, and then he had the regular husband. So he was also diagnosed with antisocial personality disorder. And Jeffrey Dahmer, and he was as a child he had fascination with dissecting dead animals. His murders were gruesome and involved torture, forced sodomy, dismemberment, that's removing their limbs, necrophilia, and cannibalism. Also suffered from antisocial personality disorder. So the environment. In most cases, children can develop antisocial personality due to unhealthy environments, broken homes, foster cares, adoption, and abandonment. Violent activities at home also can, it can happen. Fighting caretakers, abusive family members, and extreme and inappropriate disciplines also. Beatings, humiliation, torture, along with sexual abuse, sexual relations, and watching pornography can result in antisocial. Some of the symptoms: failure to conform to social norms, deceitfulness, impulsivity, failure to plan ahead, inability and aggressiveness, reckless disregard for safety and self of others, lack of remorse. Also, what to look for? It's not easy to determine if a child is suffering from the disorder because children change and go through various stages in life. However, there are a few symptoms that should raise a few flags. Displacement, when a child prefers to avoid activities others enjoyed by their peers, torturing animals or pets, aggression towards others without feeling any remorse, and a combination of erratic behaviors. The risk factors. There are certain risk factors that can trigger the disorder to surface with an individual. Some of these factors are completely preventable, and no child should undergo such trauma. Being diagnosed with a childhood conductive disorder, a family history of antisocial personality disorder, or other personality disorders or mental illness. Being subjected to verbal, physical, and sexual abuse during childhood, having an unstable and chaotic family life during childhood, loss of parents through death, traumatic divorces during childhood. Some of the complications. Certain complications tend to appear with the time as a juvenile grows older. Suicidal behavior, alcohol and substance abuse, aggression or violence, reckless behavior, and risky sexual behavior. Test and diagnosis. When a professional suspects that a child is suffering from antisocial personality disorder, they undergo a series of tests to help the experts diagnose a proper disorder. Types of tests that doctors use to to help support the diagnosis will include physical exams, laboratory tests, and psychological evaluations. Treatment. While medications do not directly treat the behavior that characterize antisocial personality disorder, they can be useful in addressing conditions that concur with this condition. Specifically, depressed or anxious individuals who also have antisocial personality disorder may benefit from an antidepressants, and those who exhibit impulse anger may improve with the given mood stabilizers. That's my works cited.